Hi guys, how are you? It's Melanie. Okay, so today is officially 1 week post-op. That's right. Last week on Monday, I had my surgery. So a lot's been going on. Sorry, haven't been updating or whatever. Okay, so on Saturday, I had an official breakdown. My goodness, so much to tell. Okay, so I was just like tired of all the bandages and all the blood, the drainages. I had to carry like tubes, you know. You guys want to know where the tubes were at. So they were like in my private area, and I did not know that until I got completely naked because, like I tell you, right after surgery, 30 minutes after surgery, they make me put. Where is it? So I can show you guys. I have it off right now. This thing on. This thing is called a girdle, and I'll be wearing this for the next 3 months. Yes. And can I tell you, it's not easy to put on. It takes me at least half an hour to put on because I'm in pain. Well, not in pain, but it's very uncomfortable. It's very, very tight. I have to freaking put lotion. Um, if it's necessary, the powder. I mean, it's a biatch to put on. Okay, so when I took that off and I looked at myself in the mirror and stuff like that, of course I got freaked out. I'm a person that I can't see a lot of blood, and then with the holes, the drainages, the it was just a complete mess, and I had a breakdown. I started crying. I told my sister I look like Frankenstein. Then that day it rained. I'm not sure it was the weather. My muscles were hurting me. I've been having therapy. Maybe it was the massage. You know what I'm saying? It was just a complete mess. And then my bank messed up on me. I had some type of fraudulent activity, and they took $2,000 out of my bank. You know, and I had to deal with this whole mixed situation here, and I had to call several times to the United States to deal with this bank situation. So I almost didn't even go ahead and do the laser eye surgery, which I went today, and they did a whole bunch of exams, and they did 4 exams, and I'm scheduled to have laser surgery on Wednesday at 7:30 a.m. Now I'm not going to do LASIK because what happens with LASIK is that it's an 8-day recovery, and since I'm leaving on the 29th, which is on Friday, late at night, they said that that's not the best thing for me. Well, what they do have, and by the way, LASIK over here is like $850, which you know how much it is over there in the United States. It costs a fortune. So, they're gonna do this thing on me, which is called Intralace, which is like the newest technology out. They mainly use it like on astronauts and you know those people that fly the aircrafts and stuff like that. So it's like one of the newest technology out, and it's about a 10 or maybe 15 to 20 minute procedure. The recovery time is 30. What is it? 30 minutes? 15 to 20 minutes. That's recovery time. Unlike the LASIK, which takes 8 or more days. And from what I hear about the LASIK, it's something about contacts. I'm not too sure about that. You have to keep going to the doctor. With this one, no. Your recovery time is 3 hours. Next day, you're okay. Good to go. So this was the best thing for me to do, considering that I'm flying out on Friday. The cost of that here, in American dollars, is $13.50. So I am saving myself a ton of money doing it here. So that's that. Um, okay, so I've been having trouble breathing. I've been out of air a lot. I've had a lot of dizzy spells, and the breathing. I got 2 answers. One was from my doctor. He told me that it has a lot to do with like the loss of blood. I've lost a lot of blood, guys. I mean, if you were to be here, honestly, I don't know how my sister does it. Just blood all over. Blood in the bed, blood in the floors, blood in the freaking bathroom. I mean, it's not like gushes of blood or whatever, but when I walk, since I have so much drainages, it's like dots of blood, like a little trail. So I got tired of the blood. I'm sick of the blood. I want it to all go away, and I can't wait till I just stop completely. So they told me I think that lasts about 2 weeks. So yeah, back to what I was saying. Um, what was my doctor telling me? Yes, my doctor was telling me that it's because of maybe loss of blood, or what did he say, Tiffany? The doctor? Oh yeah, the altitude. You know, and that was one of the first things that they told me. that once I got here, the altitude is very different, and I was probably gonna get sick and short of breath. So they say that due to the altitude over here, you're gonna get very dizzy, sick, out of breath. So then I spoke to John about it, which is my coordinator, and he told me that that happens a lot too. This is my girl, by the way, the one that they gave me, which is also extremely tight. Another thing I have to wear for 3 months. He told me that it's mainly because of what they did to me, because it has to do with the abdominal, because we're used to breathing a certain way since our abdominal is stretched so much. And what he says is that since they put it so tight, now it's hard to breathe, and I'm gonna, even when I go home, I'm still gonna have trouble breathing. So he says that that lasts about a month. Hopefully it goes back to normal, because can I tell you, it's not pretty. But that's about it. Good thing, guys, today I am a free woman. Besides, like the girdle thing or whatever, I still have to wear that. But I am a free woman. He took my drainages out. He took he took my stitches out. So I am freaking free at last. I feel so much better. Of course, what happened to me again is when he started taking it out, I started getting dizzy, very dizzy. And this doctor is so good, let me tell you, because he's like trying to take out the stitches, because what happens is he comes to the room. These people are so freaking professional. I'll get into that in another video. Oh my god, I've experienced nothing but the best. But this is the second time I've seen my doctor. He comes to my room, you know, and he does whatever he has to do to me. So today he took out my drainages. I had two drainages that were with tubes and, you know, that little baggie. So he took that out, and he took some of my stitches out. And then when he was taking out my stitches and like those little white things that are in me that are like this long or whatever, you know, to put in the holes and stuff, I got so dizzy. And when I tell you I got dizzy, it's like I was ready to pass out since I was like standing up. But he's so good. I didn't even say anything to him because I was embarrassed, because, you know, he was working on me and I'm like standing up and stuff like that, so I didn't want to say anything. But he was like, "You're dizzy, right?" He was like, "Sit down." I was like, "My goodness, you're so freaking good like that." I'm like, "Wow, that's amazing." So I had to sit down and he had to like finish the rest of the work. So I am free from stitches, from bandages, and from drainages. I do still have 2 more, which he said that I'm probably gonna have to go home with, but it's pretty easy to take out. There are those like white little strips that are attached to you, that they're like, again, this long or whatever, and that got me like really dizzy. Again, while he was doing it, I was like seeing all the blood, and it was just a big mess. And then I couldn't take a shower for like the next hour or so because I was like so extremely like faint and dizzy and all that crap. But I think I have 3 holes in the back. Let me try to show you. Alright, so these are my 2 holes right here. Okay, and then, sorry, I'm showing crack here. And then I think I have one, yeah, there's one up there. And then on my, I have 2 on my breast right here on the side. And then I still have those 2 holes right here. That's where the drainages were coming from right here. And I have 2 right here, which are the ones that I probably have to go home to. And these are the ones that bleed a lot. This one and this one. So, sorry if that's too much information, but what you would like to know. Happy with my results. Love my breast. I can't really tell you much about my stomach because it's still inflated. Right now it feels like a kangaroo, the pouch of a kangaroo. And this is because I'm inflated with all the water and all the stuff that they did during surgery. And that, again, that's what the therapist does. They squeeze everything out.